Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonwaka. First, the highlights. Imo State Government inaugurates COVID-19 Action, Recovery and Economic Stimulus Program to mitigate socio-economic effects of the pandemic. University of Ilorin Professor of Medicine urges federal government to be careful with COVID-19 funds and customize spending on pandemic to the character of Nigeria's outbreak. And Cuba to vaccinate 350 children between 3 and 18 years of age with potential coronavirus vaccine Soberana. According to the World Health Organization, in its COVID-19 weekly epidemiological update, all regions, with the exception of the African region, reported a decline in the number of deaths in the past week. Figures show that this week, Africa recorded a sharp increase in incidence, 33%, and mortality, 42%, when compared to the previous week. The health body also revealed the global number of new cases over the past week, 21st to the 27th of June, was over 2.6 million, and that the number of weekly deaths continued to decrease, with more than 57,000 deaths reported in the past week, a 10% decrease as compared to the previous week. The lowest weekly mortality figure, this was registered since those recorded since early November, and this is November of 2020. Now, more statistics from the WHO show that the Eastern Mediterranean and European regions also reported increases in the number of weekly cases. The cumulative number of cases reported globally now exceeds 180 million, and the number of deaths almost 4 million. Globally, COVID-19 incidence remains very high, with an average of over 370,000 cases reported each day over the past week. Now, the highest numbers of new cases were reported from countries like Brazil, India, Colombia, Russia, and Argentina. Also, we've seen the highest numbers of new cases per 100,000 population reported from Africa in countries like Seychelles, Namibia, and Mongolia. Well, let's now take a look at the situation in Nigeria.
The number of daily COVID-19 infections have declined in the last 24 hours, as the Nigeria Center for Disease Control announced 11 new cases reported from 5 states across the country. Kaduna and Oyo recorded 3 cases each, Plateau and Rivers 2 cases each, and 1 case from Ogun State. The latest report does not include data from Lagos State and FCT, while 0 cases were reported from Ekiti, Kano, Nasarawa, Oyo, and Sokoto states. The total number of confirmed cases now stands at 167,543. 1 person has been discharged after testing negative to the virus, raising the total number of recoveries to 163,985. 1 person was said to have died from complications in the last 24 hours, increasing the fatality toll to 2,120. Presently, there are 1,438 active cases in the country, while over 2 million samples have been tested so far. The latest update by the National Primary Healthcare Development Agency shows that more than 2.2 million eligible Nigerians have been vaccinated with the first dose of the Oxford AstraZeneca vaccine, while over 1.2 million of those vaccinated with the first dose have now received their second dose. Lagos State is taking the lead, as it has now vaccinated more than half of its eligible population, followed by the FCT, Kaduna, Kano, and Oyo. The agency is also advising persons aged 18 years and above to take advantage of the reopening of the first dose administration to get vaccinated against COVID-19. In Africa, there are over 5.3 million confirmed cases. Across the world, there are more than 181 million confirmed cases, while deaths have surpassed over 3.9 million.
The Imo State Governor, Hope Uzodinma, has commended the federal government and the World Bank in their joint efforts to address the devastating socio-economic effect of the pandemic in the country. Governor Uzodinma gave this commendation during the flag-off ceremony of the NG Cares program in Owerri, the state capital. The governor says his government will tackle the program with the same zeal it employed fighting the pandemic in the state.
Though the curve of the COVID-19 pandemic seems to have flattened drastically in the country, its negative effect on the socio-economic well-being of the people cannot be overemphasized, especially at the grassroots. One of the ways the federal government is mitigating the effect of the pandemic, especially on rural economy, is the introduction of the federal government World Bank Intervention Program known as COVID-19 Action Recovery and Economic Stimulus Program. With this all, indigenes of Imo State across the 27 local government areas are present to witness the flag off of this all-important event.
Presence of our royal fathers, our distinguished to speak.
The state focal person and Commissioner for Finance and Coordinating Economy, Doris Uzoka Anite, sheds more light on the program and how it will benefit Imo people.
It is important to note that this program development objective of NGCares is to protect the livelihoods and food security of poor and vulnerable households, and also to facilitate recovery of the local economies, microeconomies, small and medium enterprises in the state to help them recover from the impact of the COVID pandemic.
For the governor, the program will no doubt address the devastating socioeconomic effect of COVID-19 on the vulnerable and less privileged.
This is a salutary program that will sooner than later erase the devastation on the economy of the poor and the vulnerable occasioned by COVID-19 pandemic.
With Imo State getting the sum of $20 million in the first phase of this intervention program, and with its development objective of ensuring food security and safe function of food supply chains in the 27 local government areas of the state, it is envisaged that within the next 18 to 24 months, the objectives of the program will be realized in the state. Ejitope Kute, Channels Television News.
A professor of medicine at the University of Ilorin, Emmanuel Okoro, is urging the federal government to take its time before spending billions of naira earmarked for procurement of vaccines against COVID-19. Professor Okoro, who acknowledged that the virus had taken its toll on the global community, said Nigeria is expected to act based on its own needs and best interests, like countries with responsible governments. He stated this on the sidelines of a presentation at the third biennial conference of the University of Ilorin and University of Georgia with the theme Challenges of COVID-19 on Language and Culture, Religion and Security in Africa and Diaspora.
Contrary to the prediction done 14 months ago, we have only recorded just 2,600 deaths as at 60 as at April, if the data being put forward by Nigerian authorities is to be believed, compared to over 500,000 in the US. What we are saying is that Nigeria ought to be careful not to put its resources to what may not be a danger to it. Because if this virus turns out to be like the flu virus, as the evidence is showing it may become, we don't have the resources to be vaccinating everybody every year. We do not. And since we don't have the added pressure of mass deaths and overstretching of the hospitals, maybe it is wiser to temporize. But if you need to vaccinate, then target those who are most vulnerable. And these are those 65, or even if you reduce it to 50 and below, but mainly men who also have pre-existing disease. That is our message. Nigeria should not be in a hurry to spend $156 billion, naira. 156 billion naira on initial vaccination of 70% of its population. Every country takes the decision that is in the best interest of its own. Even in this pandemic, we have seen how countries have stockpiled vaccines. And you don't expect them to blame them because they have first responsibilities to their citizens.
Well, you might disagree, but let us know what you think. Well, the Nigeria Center for Disease Control, NCDC, is collaborating with the University of Lagos College of Medicine on a COVID-19 data collection project. And joining us to talk more about this is Dr. Chinwe Ocho. She's the Head of Prevention Programs and Knowledge Management with the department there. Thank you for joining us on the program.
Thank you, Millicent, for having me.
Tell us how this project helps the fight against COVID-19.
Yes, we are very happy to be part of this Data for COVID-19 Africa Challenge. It's a data science challenge that was launched by AFD, as a development agency for France, in collaboration with Expertise France and the GovLab. The purpose of this challenge is to look back at the data sets that were collected, non-traditional data sets that were collected at the beginning of the outbreak and through the phases of the outbreak, triangulate these data sets and try to see if we can use them to answer some questions, pertinent questions around behavioral factors that influence the outbreak. The challenge was launched and the call was released on December 15th of December 2020. And between that period and February 5th, 2021, a total of 83 proposals were submitted from 22 countries in Africa. And out of those 83 applications, the one that was submitted by Nigeria through the collaboration between Nigeria Center for Disease Control and the College of Medicine, University of Lagos, was among the 7 awardees. Only 7 proposals were selected to be supported through that project. So what we are looking at, our own focus in Nigeria, will be to try to see if we can understand what the facilitators and barriers to people's compliance with COVID-19 preventive protocols are. So we'll look at the social, political, and economic drivers, factors that influence people's adherence to the COVID-19 safety protocols. So we are moving away, so to say, from the traditional data sets, epidemiological data sets, to now look into those social, economic, and political factors that can influence how people perceive some of these preventive measures and their ability to comply with these measures. We will be examining how financial realities of Nigerians affected their compliance to COVID-19 preventive protocols. We'll also look at the first wave and the second wave and compare behavioral and risk factors across how people complied with our preventive measures during these waves and what was related to the trend that we saw of the outbreak in Nigeria. So we'll be looking at even how people's, some of these government protocols influence people's trust in Nigerian government, and then also during the lockdown, what are those areas that people were more likely to visit when there is a lockdown in place, and how we can organize those places to limit the spread of infection for future pandemics, and even for the containment of COVID-19 outbreak. So why this is very important to us is because data is what should provide evidence to guide policy and practice. So we're now sitting back to look at these data sets that we have collected through various partnerships, looking at them, some from Resolve to Save Life. There were some data sets that were collected by College of Medicine, University of Lagos, and the ones that were collected through NCDC. So we'll bring all these data sets together using technical support from some subject matter experts, both from within the country and outside the country. We will reanalyze this data and try to see whether we would understand better what are those factors that influence people's behavior and compliance to our COVID-19 preventive protocol.
Finally, Dr. Ocho, before we let you go, how and when will this be done? When will you be able to conclude to get this result?
Yes, it is a 6-month project that was meant to start from May and last up till October. So we had an inception meeting this June, specifically June 25th. So we will have a data camp that we intend to hold by next week, and we will start to rigorously analyze this data by October. Specifically, 18th of October, we hope to have a dissemination meeting where we will announce the findings from this data exercise. So hopefully by that period, we should be able to understand better what influenced people's behavior and what can guide policy and practice in ensuring that we're able to respond better to future outbreaks.
All right, all towards flattening the curve. We appreciate your time. We look forward to those dates and hope you can join us on the program. Thank you so much, Dr. Chinwo Chu, the Head Prevention Programs Knowledge Management with the NCDC. Thank you for joining us. The global update on COVID-19 is still ahead. Please stay with us. Welcome back. The people of Adamawa State have been called upon to ensure that they adhere to the COVID-19 protocols despite the drop in the number of positive cases there. The medical officer at Yola Specialist Hospital made the call during an interview with Channels Television in Yola, the state capital. According to him, the drop in the number of cases is due to poor response by the people. He says there is adequate testing kits. He further insists that more sensitization needs to be made, especially among the rural population who have their fears about the virus and the vaccines.
People tend to be scared when they hear that they are to take the test. So there is a low turnout of people for the test, for probably fear or other reasons. And then also, we've not had as much testing kits as we would want to carry on the test. But I wouldn't say the government is not doing its best, it's doing its best. But for some reasons, we are still short of the number of kits that will be required. I have met people with so many questions, and the government doesn't really seem to have the answers to all the questions with regards to COVID-19 vaccine. I think that's the major reason why people do not turn out there's a hesitancy, so to say. Going forward, I think the government needs to come out and educate the people so everybody understands the benefit of vaccine. And then there is also a need for proper and thorough evaluation of the vaccines to clear the doubts and the questions of the people.
Sajid Javid, the new UK Health Secretary, says the country has to learn to live with COVID-19 in a statement to MPs in which he confirmed the government's plan to return England to economic normality on July 19. In a sharp break with the tone of his predecessor, Matt Hancock, Javid aligned himself with the views of many Conservative ministers who believe it is time to discard caution and reopen the country. Well, no data we choose, he says, comes with zero risk for COVID. And he's also saying we cannot eliminate it. Instead, we have to learn to live with it. Well, joining us for more of the situation in the United Kingdom, Dr. Esen Ukurabi, GP Registrar, Worcester Royal Hospital, England. Thanks for joining us on the program.
Thank you very much.
First, how are people reacting to the exit of Hancock and the new Javid, and then, of course, you know, the pandemic fight?
Right. A few days ago, the Prime Minister announced the new Health Secretary, Javid Sajid, and following the exit of Matt Hancock. And I would say the appointment of Javid Sajid did not come as a shock to most people in the UK because he's been a part of the cabinet over the last couple of years. He served as the Chancellor of Exchequer and as well as the Home Secretary. He's known for hard work and integrity, so it was not a surprise. And we hope he will do well as Health Secretary. And for Matt Hancock, who had to resign, most people think that because he resigned due to not following his own rules of social distancing, he should have been fired by the Prime Minister. He should have been sacked as opposed to allowing him resign. And both of them, like you rightly said, have got their different perspective, talking about easing the lockdown. Matt Hancock was more conservative and more inclined to gradually easing the lockdown. But from the body language of Javid Sajid, we think he's more proactive and he will be more inclined to completely easing the lockdown come the 19th of July.
But Dr. Karabi, can we say it's all coast clear, ahead of July 19th, do you think?
Once again, I would say it's very difficult, and I don't think there is one particular person that can say the coast is clear as regards to easing the lockdown completely. The new health secretary himself said that no date that we would choose would come with zero risk. So if we lift, or if the lockdown is lifted today, it will come with its risk. If it is lifted on the 19th of July, it will certainly come with its risk. It's no more news that the Delta variant in the UK is increasing by the day, with number of hospitalizations increasing, and as well as number of deaths also trickling upwards. But it is important for us to understand that a lot of people in the UK have been vaccinated. So 84% of persons have had first dose of vaccine, and about 62% have been fully vaccinated. So we are gradually getting to a stage where we are beginning to think that this virus might be with us for a long time, and we need to start learning how to live with this virus. But I would say that the government might need to do this rather cautiously. So if you ask me, in terms of easing the lockdown, I would say it is a good idea to ease the lockdown come the 19th of July, but not to completely ease the restrictions, especially as regards to travel restrictions. I would say some of the travel measures should still be kept in place until the successful rollout of the vaccines.
All right, we always appreciate your time on the program. Thank you so much, Dr. Essen Okurebi, GP Registrar at Worcester Royal Hospital, England. Thanks for joining us on the program.
Thank you very much.
7 Australian cities have now been put on lockdown to contain the spread of the highly contagious Delta coronavirus variant, translating to more than 12 million people receiving stay-at-home orders, translating to half of the country's population. Authorities fear the virus could now spread to nearby Aboriginal communities, which are already vulnerable. State leaders say they are facing a pressure cooker situation as new cases emerge.
Brazil is to suspend a $324 million Indian COVID-19 vaccine contract that has left President Jair Bolsonaro entangled in a web of alleged irregularities. Bolsonaro, whose popularity has faded as Brazil's death toll climbed past 500,000, has denied any wrongdoing, but federal prosecutors have now opened an investigation into the deal, citing comparatively high prices, quick talks, and pending regulatory approvals as red flags. In Cuba, the clinical trials of a potential coronavirus vaccine called Soberana 2 or Sovereign 2 allegedly has begun being administered to children from 3 to 11 years of age. Cuba will vaccinate 350 children from 3 to 18 years of age with a schedule of 2 doses of Soberana 2 and 1 dose of Soberana Plus within 28 days. Over to Asia now, where North Korean leader Kim Jong-un has chastised top ruling party officials for failures in anti-epidemic work, which has led to an unspecified great crisis, putting the safety of the country and people at risk. North Korea has yet to officially confirm any COVID-19 cases, a claim questioned by South Korean and U.S. officials. But the East Asian country has imposed strict antivirus measures, including border closures and domestic travel curbs. In Indonesia, the state-owned Garuda airline is giving out free COVID-19 vaccines for passengers in the capital's Soekarno-Hatta International Airport. There is capacity for up to 200 shots to be administered per day, but the free vaccine only applies to domestic travelers who can get their second shot anywhere, as data recorded by the Ministry of Health. Just 13 million out of more than 270 million Indonesians have received 2 vaccine shots. India has reported 45,951 new COVID-19 cases in the last 24 hours, adding the total number of confirmed cases up to 30.36 million. The country has reported 817 new deaths, while there are still over 500,000 active cases in the country. Finally, Russia sets yet another daily toll record, as 669 coronavirus-related deaths were reported today. Meanwhile, President Vladimir Putin has announced that he had Russia's Sputnik V vaccine, one of the country's 4. Moscow has not approved any foreign vaccines.
Let's continue to take responsibility. You can visit our website at channelcv.com for more updates. You can see the top story there. Putin rejecting the mandatory COVID-19 jabs as Russia sees record deaths. There's several other stories there as well. It's all on our website, channelcv.com. And that's it this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.